Hi, I'm Mark Tyrrell of Uncommon Knowledge, and welcome to How to End Therapy with Your Clients. 3 ways to signal the end of therapy. So these days, knowing how to terminate therapy elegantly is a core therapeutic skill. Gone are the days when psychotherapy was supposed to continue maybe twice a week for decades. And in fact, the international guidelines for the treatment of depression suggest that if your depressed client doesn't feel significantly better after 5 sessions, you should refer them on to another professional. See reference 1. So if someone sometimes wants to catch up or just talk once in a while, that's fine, of course, as long as you're clear about what's happening. But who was it that said a therapist should assist where they can, but not leave footprints in their client's life? Therapists supply a service. If you went to a lawyer for help, but then continue to visit and pay them on a regular basis, even after they've completed the work, you kind of want them to draw your attention to that, would you not? Terminating therapy as soon as possible isn't about throwing clients out when they still need help. It's about setting clear guidelines and helping them be emotionally ready for their therapy to end. So 3 ways to end therapy. Firstly, ensure basic emotional needs are met outside of the therapy room. Everyone has basic needs for attention and intimacy. And if you don't actively encourage and help your client meet these needs outside of their therapy with you, then they'll feel dependent on you. If you're someone's only real source of human contact and attention, then of course they'll feel as if they can't stop seeing you and that your therapist is helping them. But what needs to happen, of course, is that they need to meet those needs away from you. But don't confuse this with successful therapy. Clean therapy happens when the therapist understands that the role of the therapist is to help the client with specific problems and not to meet their basic emotional needs on an ongoing basis. Okay. The therapist needs to help the client be clear about what these needs are and how to meet them effectively in their own life beyond the therapy. 2, draw their attention back to their original therapy goals. And this is why it's so important to be clear with someone from the beginning by establishing very clear and measurable goals with them. If nobody knows when therapy has been successful because no clear goals were ever defined, then nobody knows when it's supposed to finish. Imagine a builder doing this to you when they're working on your house. Okay, so from the beginning, you need to build in the expectation that therapy will end and clarify the parameters that will govern this. And you'll be saying things like, so we'll know that you won't need to see me anymore when you're sleeping better, you feel more confident sexually, you've stopped smoking. Okay, that might be a signal if they come to stop smoking. And the end should be there from the beginning, and we need to know that. Okay, then we can draw their attention back to that. When these goals have been achieved, you draw the client's attention back to the initial goals. Okay, so you came to see me because you wanted to whatever. Now that we have achieved those goals to your satisfaction, was there anything else you wanted to work on before we wrap therapy up? Okay. Number 3, make it clear from the beginning that therapy will be finite. And of course, you can't always tell exactly how many sessions a person is going to need to get over a depression, for example, or to successfully stop drinking. But you can give them an indication. So I might say something like, many people can be helped within a few sessions and oftentimes feel better even after a single session. Remember the power of expectation, of the placebo effect. And if they ask, what happens if they don't feel better? I might suggest that if after 4 or 5 sessions they feel they haven't benefited above and beyond enjoying the companionship of therapy, then I'll refer them on to someone else, okay, if they're happy for me to do so. If someone wants to pay me to be a professional ear every couple of months, that's fine, as long as neither of us think that anything else is happening, and I'm clear with the client that that is what we're doing. So you don't need to throw someone out in the cold, but what you do need to do is ensure the outside is warm enough for them. Nothing does or should last forever, including therapy. So I hope you found that useful, and if you did, please hit like and subscribe, and if you want to hear when my next video is published, hit the notification bell below. I'm Mark Tyrrell of Uncommon Knowledge, and if you'd like to subscribe to my email newsletter, you can find it over at unk.com/blog, and thanks for watching.